Now, as the warm weather warms for spring, we all have to follow this health alert because it is fun to get out there, certainly with the kids as well. But you need to know about the risk of ticks. There is a common misconception that ticks in Florida don't carry Lyme disease. That's just not true. In general, the number of Lyme disease infections has gone up in recent years. In fact, according to the CDC, there's about 476,000 new cases in the United States every year. Look at that line, right? So, and this isn't just harmful to humans, also, it can also impact your pets as well. Melissa Bell is the president of the Florida Lyme Disease Association. Dr. Carrie Clark is professor of epidemiology at UNF. Both are joining us this morning in the studio. Thank you for being here. We appreciate you. You've got some demonstrations, some things that can help in terms of preventing ticks. But Dr. Clark, if I could start with you, please, first. Would you explain the risks and the dangers of being infected with Lyme disease?
Well, Lyme disease is a very cryptic infection. It kind of sneaks up on you, and you may not have noticeable symptoms at first, but eventually it leads to fatigue and headache and brain fog, cognitive, neurologic problems. It can affect the entire body, and it can actually debilitate people over time.
And it can be somewhat delayed also, and you can go for a long time. And Melissa, I know you've experienced this because I interviewed you years ago about Lyme disease and the impact it's had on you and your family, which is why it's so important that first we start talking about prevention of tick bites, and then also, if you do get one, how to remove it. First of all, would you explain how to avoid being bitten by a tick?
Thank you, first of all, for having us here today. It was actually media stories that helped us figure out that we had Lyme disease in multiple family members. So without media attention, we perhaps would not be as well as we are today. With a proper diagnosis and treatment, we were able to recover in large part. As far as tick prevention, there are multiple things you can do to prevent tick bites. First and foremost, there's a product called permethrin. And you use this not directly on your skin, but rather on your shoes, on your socks, on your clothing. And this really is effective at repelling ticks. You can spray yourself, or there are products that are pre-infused, such as Insect Shield. For your skin, you can use items like lemon eucalyptus oil, there's different herbals, and there's DEET.
And these are nice also for parents who might be concerned about putting it on the skin of their children who are young, because you want to be able to camp, you want to be able to take the kids out, you know, the parks and everything, and not kind of live in fear. So there are things that you can do to prevent it.
Right, right. And so the permethrin is more effective, but again, that's on the clothing, not on the skin. So these have limited effectiveness, so you don't want to rely solely on the repellents on your skin. In the event that you do have a tick bite, it's important not to panic. You should have a tick kit that's already ready with items such as this device to help.
I've never seen this before.
Yeah, it's a fine tip tweezer, or you can just go old school. You know, it doesn't have to be fancy, but the key is that you want to use the fine tip tweezers as close to the skin as possible and remove the entire head of the tick. You're going to want to put it in a container, indicate the date and when it happened, and we recommend for people to send the tick for testing. That's available either through Dr. Clark, or there's places you can send it like Tick Encounter or Tick Check, and that way it can test for not only Lyme disease, but a whole variety of infections that can spread by ticks.
And I want to bring Dr. Clark into this also. You're holding up an example of, would you explain what you have in here?
I have in these two vials right here probably about 250 ticks that I collected yesterday in the St. Augustine area, just in about 2 hours. It was actually in a camping area. And I have in this vial, there are probably over 100 of the immature stages of the tick right here that I collected just off of my cloth drag in about 15 minutes after I went back to my vehicle and finished for the day.
Yeah, so this is the season for them without a doubt. And Dr. Clark, would you explain why it's so important that the tick be removed correctly? Because there's a lot of myths out there. You know, you put Vaseline, I think I've heard, on them. You burn them. None of those are a good idea because you don't want the tick to essentially kind of vomit into the skin, which ends up infecting you with the Lyme disease.
Exactly. The key is just to find them by regularly checking yourselves when you're outside doing these types of outdoor activities, and to just remove the tick as quickly as possible. The longer a tick is attached, the the higher the probability that it might transmit some type of pathogen.
Yeah, and Melissa, the ticks can hide in certain areas, but there are specific ones that they generally, kind of run to, so to speak, if you're infected, because the longer it goes, the bigger it gets, and that's usually when you find it, but you want to find it as soon as possible.
Yes, we recommend anytime after you've been outdoors to promptly shower. That might rinse off any unattached ticks, and at the same time, you can do a thorough tick check. You want to check in the hair, behind the ears, under the arms, behind the knees, and the groin. Really, sometimes you can run your fingers over and you might feel a bump that you would otherwise not see.
And so you don't, and you want to, and you can remove it yourself, but if parents are nervous, they could certainly call their pediatrician for advice on that. Dr. Clark, what about pets?
Well, our pets are also susceptible to Lyme disease and several other tick-borne infections, especially dogs. It's surprising that humans and dogs actually share a lot of the same tick-borne diseases. And so dogs definitely get exposed to ticks at a much higher rate than people do, and they're great sentinels for tick-borne disease risk in various areas. And we see thousands and thousands of cases of Lyme disease and other tick-borne infections in dogs throughout the state of Florida.
And Melissa, there are a lot of Lyme disease cases that go unreported in the state of Florida.
Unfortunately, that's true. We had relied upon data by the CDC and the Florida Department of Health that made us think that Lyme disease was very rare here, but that's simply not true. It's something that if you're not looking for it, you will not find it. And unfortunately, our doctors do not believe that it's here in the state, so they don't test for it. And then patients end up going for years, sometimes decades, without a proper diagnosis and treatment. And then their joints are destroyed. They might have heart failure and very serious consequences. Based upon data from insurance, from canine, and there's also surveys of Lyme patients, they estimate that only 1 in 50 actual cases are counted by the Department of Health. So don't have a false sense of security of thinking that Lyme disease and co-infections are not here. In addition to Lyme, ticks can spread Babesia, Bartonella. They can cause anaplasmosis, ehrlichiosis, and there's a number of viruses also that ticks can spread.
Which is why it is so important to make sure that you take a tick bite seriously and also search for ticks. Melissa Bell, thank you for being here.
Thank you so much.
We appreciate it. Dr. Clark, we appreciate you being here as well.